Hello everyone, I am Dr. Deepa Jaishankar. I am a prosthodontist. I work as an associate professor in one of the dental schools in Bengaluru, and I also run a private practice called Tooth Firm in HSR Layout, Bengaluru. I have a fellowship in temporomandibular joint disorders, orofacial pain and sleep medicine from Smile USA. When we say jaw clicking and popping, it can be quite a situation for a patient because whenever the patient opens and closes, there is a funny joint noise which is quite audible to the patient, or sometimes when you're actually sitting closer to a person who has clicking and popping. Now, having said that, it comes with a long history. Whenever there is a patient having this kind of a click, the temporomandibular joint click we call it, it is as a result of some long-term trauma which the patient has ignored. Because generally what happens, there will be some amount of pain and then the pain reduces because the temporomandibular joint has the ability to adapt to the new situation. Most of the time, if it is associated with pain, it is an inflammatory pain. We call it discitis, retrodiscitis or synovitis and arthritis, where the particular temporomandibular joint is out of the socket and then tries to hit certain area of the joint space, that is the articular disc, and gets back into position. So whenever we examine a patient with a click, we do it with a stethoscope. We hold the stethoscope on the patient's temporomandibular joint, ask the patient to open, close, open, close. You can hear a distinct click or a pop of this joint whenever the patients open and close. But if they are associated with pain, then it becomes important that we try to give them some relief because of the inflammatory situation of the joint. But if the pain has subsided and if it is only a click or a popping sound, most of the time we do not intervene and do any kind of treatment. We just make the patient aware of the situation and ask them to be careful and put them under evaluation. Thank you.